I put on 10 kilograms, and one random morning, my clothes didn't fit, and nothing in my life had changed to explain it. I was told everything looked fine. Nobody said the word perimenopause.
90% of clinicians have very little knowledge or confidence around treating women in perimenopause and menopause.
A lot of us are just managing this silently, right? There's still so much shame around this.
No, we can't really be living like that. There must be an answer to this. We have a whole generation of women who are deprived of the possibility of using hormones, but clinicians who didn't use the hormones. And actually, I was one of them.
Somewhere in my mid-40s, my body started doing things I could not explain. I put on 10 kilograms, and one random morning, my clothes didn't fit across my upper body, and nothing in my life had changed to explain it. Most of you watching already know it. If you are a woman over 40, you have either lived it or you are living it right now. The sleep that stops working, the mood that shifts without warning, the body that doesn't quite respond the way it used to. So I went to my doctor. Of course I did, because that's what we're trained to do. You take the symptoms, you book the appointment, you sit there, and you describe what's happening to you. And you wait to be told what to do about it. I was told everything looked fine. Nobody said the word perimenopause. So I went to a new doctor. I gave her the blood test, every scan, every report from the last few years, and she read them. And then she sat me down and told me what she found. What she said is the reason I'm making this episode. Because if it happened to me, it's happening to a lot of women. So I'm going to ask her, what is it that was missed on all the reports that I've been going through all these years, all those tests? What is it that my doctor missed? Welcome to Raw with Uma. And in this episode, I'm going to be sitting down with my doctor. But before that, before she answers this very important question about what my doctor missed, please hit subscribe. I'd really value your support. And if this episode is useful to you, please share it with your friend. So let's get into it. Dr. Foong, welcome. And who are you? And why should people listen to you?
Hello, Uma. Really lovely to see you again. I am a primary care doctor, and I've been practicing for 25 years, trained in the UK and back in Singapore for the last 12 years now. Primary care is a broad-based approach to medicine, and that is why we've managed to dive deep into your case. I run Oslo Health with a team of doctors. Women's health and primary care, precision primary care actually as we call it, is the focus of our practice today.
All right, wonderful. So let's get into the first bit. I came to you and I dumped all my medical records on you. I found you because I started writing about perimenopause and somebody said, you need to go meet Dr. Foong. So we met. And you picked out a few things that was missed out on my medical reports. And, I'm making my reports public for the first time. So we're going to talk about it openly so we can help other women. So what stood out to you? What was missed?
Your opening, Uma, is not uncommon. Quite often we have people coming to us saying, my doctor said this was fine. And I think it's hard to say what was missed. I think it's a combination of things. Firstly, there are a couple of parameters in there that we would use different reference ranges. And what really was missed, if we want to say it in that manner, is pulling the different parameters together to make that diagnosis. We talk about perimenopause. I wouldn't say it's straightforward to make the diagnosis because often women say, why don't you run the hormonal panel? Isn't that the most obvious thing?
What is a monopanel?
Well, we'll check the hormonal levels of estrogen, progesterone, something called FSH, follicle stimulating hormone, and LH. Why don't we check that?
Yeah.
Well, isn't that the most obvious thing to make a diagnosis? And that's
Yes.
probably why that was missed, because the truth of the matter is we can't measure those hormones. They're fluctuating so wildly during
Yes.
perimenopause that that's not going to give us the answer.
So my previous doctor was a man, and he did run it once. So it's called the hormone test. So anybody doing a full medical report, and it kind of shows your progesterone, estradiol, LH, and FSH.
That's right.
Right? So for those who don't know, what is LH and FSH?
Well,
and
yeah.
maybe we should explain estradiol and progesterone as well.
So let's start with estradiol and progesterone.
Yeah.
Those are the hormones that are produced by your ovaries. And actually, by the way, testosterone is also produced by your ovaries. Progesterone and estradiol actually influence the production of FSH and LH that is actually produced by your pituitary gland. So progesterone, estrogen, FSH and LH influence a woman's cycle every month. Okay, so what happens in perimenopause is the production of the hormones start to fluctuate from our ovaries. So they start to go slightly chaotic. So measuring it's not helpful.
Yes.
And that's usually why perimenopause is missed. But what we need to do is to pull together the constellation of symptoms that actually, when you introduced this session today, what happened to you in your 40s? It's pulling together those symptoms and couple of parameters that we can measure, not hormones, in your blood test panel. And we call that a constellation to arrive at the diagnosis of perimenopause.
Okay. So what did you pull out for me?
Right. So a couple of things.
We're looking at my actual medical records
Yes.
right now.
So we always, actually, if I can just start off by looking at your records and running through them and talk through, we always start with cholesterol. And there's actually a reason why we start with that. Cholesterol is one of the main risk factors for heart disease. Yeah. And actually, heart disease is a very common condition that a lot of us, a lot of people would get when they get older. So we often start off there. Your cholesterol panel is slightly raised. But when I looked at that and comparing it to the last few panels, the trend was rising. And actually, that's what we want to see. That's what we need to pick out. It's not what is it at this point, but is it climbing? Because on its own, the reading that we had on, the most recent reading gives us a spot diagnosis of what was happening that day. But a rising trend is often what we see in women because estrogen generally is protective, reduces plaque formation, and hence a rising cholesterol is something we see in women as they go through their 40s, which is when perimenopause happens.
Yeah, and I think what's so common is that if you know that you have cholesterol running in your family and you know that you need to start tracking it early, and then you get to your 40s, you do such a good job with exercise and food, which I've been doing in my late 30s onwards. And then my cholesterol kept going down. And then nothing changed. And then it goes up, right? That, I think, is one of the first signs. And then as women, we tend to beat ourselves up and go, oh my gosh, I'm not trying hard enough.
That's it.
And then nobody ever connects hormonal levels to cholesterol.
Absolutely. I think that the shift is often when we've been doing the same thing and something's shifting.
Yeah.
Like you said, it's often, is it us? But it isn't. Could it be something else? So cholesterol is certainly a trend that I noticed over the last couple of years have been going up.
So when we're looking at the cholesterol reading, are we just looking at the bad cholesterol, the LDL?
LDL is the bad cholesterol, as you said, is one that we focus on. HDL is also important because that's the good cholesterol and we want to keep that as high as possible. Yeah. Triglyceride often reflects in simple terms, I often say how well you're eating, it reflects your nutritional intake. And we want to sort of keep that, low, below 1. Something about sort of reference ranges we will be talking about is the reference range often is quite generous in the lab report. So if we're trying to aim, looking at your sort of dietary intake, the reference range, I use a slightly different, stricter reference range for triglycerides.
Okay, so my cholesterol score was, when we did the test last year, what was it?
So your total cholesterol was 5.6. I'm working
5.6.
in millimoles per liter, by the way. Yeah. HDL 1.65, LDL at 3.53. That's slightly high. Would like that lower, below 2.8 if possible. And your triglycerides was 1.1. I'd like that below 1 if possible.
So how do I, with perimenopause, work on improving those scores?
Right. You're working very hard from a diet, exercise point of view.
Yeah.
Yeah. Lifestyle factors, lifestyle interventions always fundamental. With cholesterol, the immediate reaction is often from doctors to give you statins. Statins is a medication that's used to treat cholesterol.
Yeah.
So perhaps I'd like to expand a little bit on that approach. We should not be reactionary with using statins for high cholesterol, especially women in their 40s. The first thing we need to do is to slow down and work out what your actual cardiac risk is. So taking your cholesterol reading, which is only one risk factor, we need to start to put in the other risk factors, which includes your age, blood pressure reading, weight, family history, diabetes, smoking, and actually come up with a risk score. That's talking about risk for a heart attack or a stroke.
Yeah.
So if your overall risk score is low, we shouldn't automatically go in to give you statins because we have to outweigh the risk of statins versus your risk of having a heart attack or a stroke tomorrow.
Yeah.
So the answer to your question is what do we need to do? I think lifestyle factors, yes. But for women, one of the things we really want to look at is perhaps considering the use of hormones.
Yes.
HRT.
Yes.
Because we know if we look at the process of how hormones work, they actually have an impact on our cardiovascular system. They could reduce the formation of plaques, keep our blood vessels supple. And so there are other things we could do and not reach for statins.
Yeah. Yeah. So let's talk about HRT because firstly, I think a lot of people don't know what HRT is. So hormone replacement therapy. And for those who know, I think may have been clouded by over 20 years ago, the one announcement that just, put a black cloud over HRT. So a lot of women are apprehensive, even if they might heard of the term, right? So what do you think about HRT? Because I was 47 last year when I came to see you and you put me on HRT and I'm not even menopausal yet, right? So why do we do that? And what's the benefits of HRT?
If we go back and look at what women's biology is doing, okay, we all will go through the inevitable day that's called menopause. That's the day when our ovaries stop producing progesterone and estrogen. And testosterone, by the way. And we know that the time running up to that's called perimenopause, where our hormones get a lot more chaotic. So I always say at this point, I want to take us back to a little bit of history. Let's look at what happened in the 1960s. Women used to go through menopause around about 50, and women only lived then till 60 or 65.
Yeah.
What happens now? What's our lifespan now? It's easily 80s. The lifespan here in Singapore is 83. So we have over the last few decades increased our lifespan. So we actually have a lot of data to show us what happens to women as they get older. And not even looking at clinical data. Let's just think what happens to women when we get older. Think of an elderly lady. What do you picture?
Yeah, she's
older,
frail,
elderly, frail.
brittle bones.
She's not as strong.
Yeah.
So picture that. So that is one of the factors one of the biological factors is women haven't got hormones over the last few decades. In the 60s, we lived to 65 with 10 years. We're not seeing that as much, and now we are. So hormones do play a big part in our biology, and we also have some data to show us what HRT, hormone replacement therapy, can do. Yeah. And one of the strongest effects of HRT is how it helps protect our bones. Yeah. That's one that is firmly in guidelines, that we know HRT can prevent, treat, and reverse osteoporosis.
Yeah. And so women who are concerned about HRT, what do you have to say to them?
Actually, let's unpack a little about, where the concerns come from. And you've mentioned that already 20 years ago, that Women's Health Initiative really started the era of the concern over HRT. There was a study that was done on hormone replacement therapy, and the newspaper got hold of it and published a headline that said HRT increased breast cancer by 25%. They're not technically wrong, but they just sensationalized the data. As a result of that, the use of hormone therapy decimated overnight. Up to 40% of women were on HRT at that point. Today, we're looking at, even today, anything between 8 to 15% of hormone use, even after all this time.
Wow.
Okay, that was a huge concern around HRT. One of the difference between hormones that we used then and hormones used today is important to know is it's different. The hormone that was used in that study is what we call synthetic hormones. Today, the hormones that we are prescribing and the hormones that you've got are called bioidentical or body-identical HRT. And what that means is the hormones are chemically or molecularly similar, identical to the hormones your body is making.
Right.
So the type of hormones that we have to prescribe and give women today is also changed. So from that point of view, you can, I guess, infer that the safety of these hormones are much better than they were before.
Yep. And I remember that you set me off for a mammogram. And it's something that we will do every 6 months as I'm on HRT.
Every year.
Every year?
Yeah.
Okay. Yeah. So once a year. So if you're on HRT, just keep doing your mammograms every year. Yeah. Now, it's not like in my tests, there was cysts and lesions, right? Which is very common as you age.
No, actually, cysts and lesions are very common when you have cycles. Okay. It's the change in the hormonal pattern every month that is one of the causes or one of the factors that cause these nodules. So having nodules is not uncommon. And so women should be, told that and work with a doctor, a good doctor and a radiologist who reads the report thoroughly and be able to work out which nodules they should be worried about and which nodules they shouldn't. Hormones, HRT, around breast cancer, we know that hormones definitely could be one of the factors that increase the risk of breast cancer. So hence we should be diligent when you're on HRT to still continue regular screening. But why hormones was your question earlier on, and breast cancer. It's because hormones we know can protect our bones and our heart and our brain. So actually the benefits of having HRT at this point, in one line, if I may say, it possibly outweighs the risk of breast cancer.
Yeah, and that's really why I went on HRT. It's, for me, the longevity piece, and I want to get ahead and have a stronger foundation instead of waiting for menopause to happen and then trying to fix it, right? I think it's really about the steps you take daily. And so for those of you who are curious, a lot of people are like, what's HRT? So let's show you what I'm using. So this is the estrogen. And they also come in patches, but the ones that I'm using is in a gel form. And it comes in a sachet like this. And when we first started, you said just try half each morning, right? So it's this translucent gel. So I started with half of this. And after you shower, you put it at the side of your thigh. Is that because it's the largest muscle?
Well, largest area.
Largest area? Okay.
Yeah.
And so for those of you who are about to start, just so you know, it takes about 10, 15 minutes to dry up. So, if you're rushing for that appointment, just remember you're going to take a little bit more time for it to dry before you can put your clothes on. Otherwise, it's going to get onto your clothes.
Right.
But this is what estrogen looks like. And then we have progesterone, which you take day 15 to 30.
So in your case, yes, the second half of your cycle.
Second half of your cycle. And it looks like this. These are pills you take 2.
Yes.
And you take them at night.
Yes.
Because when I started, I took them in the daytime. And he's like, no, take them at night. Why?
One of the benefits or one of the effects of progesterone is it actually calms you down and actually helps sleep.
Yeah.
Okay. So it makes some people who are more sensitive to progesterone can feel quite sleepy. It's best taken at night. And
Yeah.
it really, and sleep disturbance or, effects on their sleep is often something women experience in perimenopause. So taking that at night can really help your sleep.
Yeah. Another thing that was missed on my report was vitamin D, right? Tell us about vitamin D. What levels should it be? And I was within range, but you said it is nowhere near where you'd like it to be, right?
Were those my words?
Yes.
It was 30, it was 33.5 when I saw you.
Yes.
And the reference range is between 30 to 99. Just look at how big that range is. So we know actually that because it's such a big range, we're really aiming for 45 to 60.
Yeah.
Okay, firstly, what does vitamin D do? Lots and lots of things. But low vitamin D can impact a lot of our sort of biology. And the symptoms usually are we feel quite tired. We have sort of muscle aches. It affects our mood. It affects our libido, our immune system, our metabolism. Okay. So having optimal vitamin D levels is crucial.
And as you said, bone health as well, right?
Yes, bone health. It helps absorption of calcium. Vitamin D mainly comes from the sun. We don't get enough from our diet. Our body cannot synthesize enough vitamin D. So we're not going to ask you to go out, anyone to go out in the sun anymore. We have to protect our skin. We're worried about skin changes. So actually, a lot of people are deficient in vitamin D here in Singapore as well. Up to 70% of people in Singapore are deficient. So coming back to you, 33.5. We're aiming for 45 to 60. So we were quite far off. But what happens when you look at the range is it's 30 to 99. So most of the time, we'd look at the range, and then sail past and say, Uma, everything is fine.
So when I first came to you, and then we did the second test, it actually went down. Right? It came down to 32.4 when it was 33.5. Despite taking a weekly dose of the 25,000 IU of vitamin D. We'll show you what that looks like in a minute. And then you said double the dose, right? So was I having an absorption issue? Because then you said start taking 2 vials, which is 50,000 weekly for 12 weeks. And then we ran another test and then it showed that it went up, right?
Absorption issue definitely is one. We know that it's dependent on what your gut health looks like as well. Yeah. So doubling the doses has allowed it to go up. I think it was to about 40, 42. So we need to keep going for certainly much longer. And that is when you have to individualize the care. So generally, I would say high dose vitamin D for about 12 weeks for most people would get them into the range between 45 to 60 if they're starting between 20 to about 30. But that's when you have to individualize that. And one key thing about vitamin D is you need to continue taking a maintenance dose after correction. And that is what a lot of people don't do. We correct that, they feel a lot better, they stop taking the vitamin D. It takes about 3 months and it falls back down to baseline again. And your baseline was about 33. Actually, I recalled when it was 33, you came in and you were taking a slightly different vitamin D.
I was taking the pills.
Yes, you were taking the pill.
Yeah.
Yes, exactly.
Which I order off the internet,
Yeah.
And who knows, right? And whatever manufacturer or pills, it's so hard to tell which of these are effective, right?
In fact, I did recall the dosage of your pills was quite high.
5,000.
5,000 exactly. And
Yeah.
I was quite surprised it was only 33 at that
So
point.
these are what the vials look like. And these are the 25,000. So I'm now on them every 10 days. And I'm about to do my annual next month. So we'll find out what happens then. But look, if I didn't move much, right, and the results are well, hopefully not, but what would be the next course of action?
What we probably will have to do is to give you a higher dose for a longer period of time. It just needs a lot of, it needs adjustment. Going back to the symptoms of vitamin D, because those symptoms that we listed, mood changes, energy levels, metabolism, they're the things that we see in women when they go through perimenopause, which is why it's so crucial to correct your vitamin D adequately. If we don't, women have these symptoms and we often say, well, it's all perimenopause. And that's also not accurate or fair to perimenopause.
Yes. And I think we can be overwhelmed about what to fix and what to pay attention to. And I think what I appreciate about working with you is that we always just focus on one thing before we move on to the next thing. I eat generally well. I work out 3 times a week. And then we moved on to sleep, right? And so I use the Aura Ring to track my sleep. And you looked at my sleep data. I mean, I used to brag about being able to sleep on a park bench. And now I'm like, when will I fall asleep? And it's been a few years of experimentation. And there's quite a few supplements here that I brought today that I was using, whether it's theanine, magnesium biglycinate, apigenin, those. So I know when you looked at my records, you looked at my Aura reading, and you said, not enough deep sleep. And your deep sleep is coming later, which tells us that I'm tired. Yeah. And so you said 2 things to me. One is my wind down routine. And then 2, magnesium biglycinate. Yeah. Why is sleep so hard when we're in our 40s with hormones fluctuating? Like, what is it doing to our bodies that isn't allowing us to sleep well? Also, I feel hot all the time now, but it doesn't feel like hot flashes.
Yeah. Sleep is fundamental. Sleep is one of the fundamental foundational pillars to our health. There are actually 6 pillars: sleep, nutrition, exercise, mental health, social connections, and the last one, avoiding risky substances. In other words, don't smoke, limit your alcohol, or actually don't drink alcohol. So 6 pillars. But of the 6 pillars, sleep is the number 1. But these are 6 foundational pillars to health. Okay, that's why sleep is so important. But what happens in perimenopause is, why is it affecting sleep? Hormonal changes, the fluctuation in our hormones, is actually affecting the way we're settling down to go to sleep. It causes hot flashes. It may not be hot flashes, but it makes us feel hotter. So it's actually disrupting our sleep. It's disrupting the way, progesterone, as we talked about earlier, while you're taking progesterone, is actually important in that calming effect. And when we have fluctuating hormones, we may not be getting the wind down that our hormones should be giving us. So there are many reasons. Perimenopause affects our mood. So mood then affects the way we are. We may feel more anxious. So then we have more trouble winding down. Yeah. So seeing sleep disturbance is very, very common in perimenopause. But if we want to look at sleep in a lot more detail, I was so glad you wore an Aura Ring because it gives me data.
Yep. Yes. So important to collect our own data.
But there are 2 symptoms that I usually see. Some people have trouble falling asleep. Some people have trouble staying asleep. Those are the 2 common symptoms that one can describe if they don't have data. And that usually is because they're still quite wired before they fall asleep. And so you then have trouble falling asleep and staying asleep, because in the first half of your sleep cycle, you should be in deep sleep. And you transition into the second half, which is light and REM sleep. So deep and light sleep cycling, and then in the second half, light and REM sleep. So you have trouble staying asleep, and it affects your sleep quality often because you're not winding down in your, what I call is the baseline stress level at night is a bit higher. And often issues around sleep isn't the issues with sleep, but in the case, what I said to you is your wind down routine, because you're still, your brain's still buzzing. and you're still going before, and you're not winding down. You're not having enough time to wind down. And that's really sometimes our modern lives, right? We go out, we have dinner, we have late calls, we still have to work late into the night. We work through time zones for, quite a lot of people nowadays. And we're not winding down adequately. Yeah.
And I like that the Aura Ring has the daytime stress.
Yes.
Right? So you were looking at mine, and it was just showing that I was never very much in the restored state. Although my stress right at the top peaks were very few, I think engage was where I mostly was, but I was rarely in restored. And that's what you're talking about in the wind down. Like if you don't have enough restorative periods, then it's hard to get into sleep and then stay asleep.
Absolutely. But that also applies to daytime. Not just the winding down, but actually that applies to daytime.
Yeah.
Because quite often the wind down is what takes a couple of hours before sleep. So I was, going back to when the sun sets, it's that actually triggers melatonin to be released in our system. Okay, melatonin helps that calming, winding down sequence that we need, and it takes a couple of hours, and that's what we should be doing. But modern life interrupts that, and we're not winding down as well. If we're starting off here during the day and needing to wind down to here at night, if we're spending our day being, often running at a high stress level, we're starting at a higher point.
Yeah.
So we should finish or have our day running at a lower baseline, which is why that Aura data is quite helpful to see what our daytime is like. So we need to have more sort of restorative periods during the day so that we can bring our baseline.
It's so tough
down.
though. It's so tough. It's like...
I have a tip there.
Okay.
It's actually being mindful and practice breathing during the day.
You did say this. It's like take the 2 minutes or even a minute during the day to do mindful breathing, right?
That's right.
Yeah.
And throughout, so 2 minutes, 1 to 2 minutes, 3 to 4 times a day, that really helps reset the day and helps to bring those levels down so that we're not running on high all the time.
Yeah, it's tough, right? Because we're in a time period where we're working all the time. We're on our phones. We can work from anywhere. So even if we're going for a walk, I'm looking at my phone, checking messages, sometimes doom scrolling. Like none of that helps with winding down, right? The screen time, the blue light, just all of that combined. And then thinking about things. I'm a thinker. And so it's so hard to shut down in my head. So I think for me to relax, it's just so hard. Yeah.
And I think that's where the breathing really would help, because you have to dedicate that time to just focus on one thing, which is breathing. And I know it's often hard when we have brains that, we're a thinker. That's how we feel engaged. So if you do that routine of breathing a couple of times a day, that hopefully will get you into a habit. And it's a habit that you will just need and want to do several times a day. And the more you do, the quicker you can get into that zone each time you breathe.
Let's talk about what women should be taking in perimenopause. Now, I've brought a whole stack of stuff that I've been trying. Either I read it somewhere or heard it on some podcast that I should be taking it. But if you had to narrow down and just your top picks, if I'm a woman in perimenopause, what supplements should I be investing in?
If you have a busy life and have trouble winding down at night, I would definitely take magnesium and magnesium glycinate or bisglycinate, which is what you've got there.
Yes.
To wind down before sleep. There are a lot of supplements out there, so certainly we want to look at the evidence behind each supplement and which one actually comes with a lot more evidence. Creatine is definitely one that would help.
It's so hard to take. It's this chalky white powder that you got to put in a smoothie or some shake or yogurt to like down it. I mean, it really tastes like chalk.
Or a coffee, which is what you can do.
I don't know.
So creatine,
Yeah.
good for muscle recovery, brain, helps our brain cognition as well.
For women, it's recommended to be 5 grams, which is 1 spoon. Do you recommend double dosing?
No.
No.
5
Okay.
grams is sufficient.
Okay.
And that's really for muscle recovery. Women lose up to sort of 5 to 10% of their muscle mass from their 30s. And so creatine will help that alongside strength training.
Yep.
What were the other supplements you've got
What
there?
about fiber?
Fiber is helpful. The evidence around fiber is it's good, it's strong. It helps sort of insulin, helps reduce insulin resistance,
Yeah.
which is something that our metabolism, or our sort of insulin sugar control can change during perimenopause as well. So
Yeah.
fiber is certainly useful for that.
Okay, so magnesium biglycinate for sleep, creatine for muscle strength building, plus strength training. You won't get muscles just by taking this. Fiber, omega-3?
Omega-3.
Yes.
Yeah. Omega-3 is another supplement with really strong evidence. It really helps inflammation. Inflammation is a process that happens quite a lot at this stage. That's due to fluctuating hormones that has impact on our bodies at a cellular level. We see inflammation in your blood panel in common tests that may not be always interpreted.
Okay.
And I will look for what your HbA1c, what your blood sugar control is looking like, what ferritin, what your iron ferritin is. That actually is, if it's higher than perhaps where we expect it to be, could be a sort of what I call an early signal of inflammation. Homocysteine, which we use as a cardiac marker, but also a sign of inflammation. Once again, looking at the ranges of homocysteine, that gives us early clues of inflammation. Okay, so omega-3 really helps with inflammation, and at this stage, when there's a lot of these processes going on, omega-3 certainly would help.
Okay. Anything else? So we talked about vitamin D. I take probiotics as well. And I have a whole bunch of other stuff here. Curcumin.
Curcumin is one that's good for inflammation. I
Yes.
think you can add that in. It wouldn't be in my perhaps top 3.
Yeah.
Yeah. One of the things about all the supplements is we want to keep an eye on your liver function. And I know your liver function is fine. And you're taking these supplements, your body is able to handle that. Okay. So actually, some people may be taking only 2 or 3 supplements and their liver function may start to go up.
Okay.
May or may not be supplements, but that's usually one of the most common causes if they're fit and healthy and not drinking too much alcohol. So we have to be aware of that. The rate of impact, the people who have liver issues with supplements is quite small, but it's not really as harmless as we think it is. Yeah. So in your case, you can carry on taking them, but if we had to streamline that because we want to protect your liver, then those that we've just listed would be in the top 3, top 5. Probiotics, definitely, because that really helps our gut health. The link between our gut and our brain, I mean, it's called the gut-brain axis. That's really, well established. The brain talks to the gut talks to the brain. How we feel, how we, how our mental health is, what our mood's like, how anxious we feel affects the function of our gut. The quality or the environment of our gut health affects our mental health. So it actually goes both ways. Probiotics are generally helpful to try to give the gut environment or give your gut, the sort of most optimal environment that it can have. So probiotics definitely, alongside fiber. I think, did we mention fiber?
We did. Yes. What about CoQ10?
So coenzyme Q10, great for the heart. If you've got slightly raised cholesterol, take coenzyme Q10. That could be helpful.
Zinc.
Zinc. Zinc is a great one for our immune system. Really good one for immune system. And actually, I saw the vitamin C, the Swiss Ray vitamin C and zinc as well. Zinc, great for the immune system. I often would ask one to take vitamin C and zinc when they are coming down with a cold, a virus. Like, just at start, when you feel it's coming on, take that. And that really helps to boost your immune system and hopefully bat the cold away or shorten the duration of your cold.
Yeah, that's a game changer. I've tried it I don't know how many times now, 15 times. And so I took your advice. I was like, if I don't want to get sick, what should I be doing? And you recommended this Swiss Ray tablet that you take the moment you feel something's about to come on. I tend to feel something in my throat sometimes. And so at the slightest inkling, just take a tablet and it just goes in water and you drink the whole thing. It's worked all the time for me. So that was a good hack. Should you go to the gym when you're feeling I think something's about to come on? Because some people say you should go to speed up the process of this cold coming on.
Okay, so it's a fine balance. When you have a cold coming on, your immune system needs to work a little bit harder. And I think that the advice around, go to the gym, push, is because we're actually trying to boost and stimulate our immune system so that it'll work that little bit harder and hopefully fight the cold. But the problem with that fine balance is if you're pushing too hard, you're tipping your immune system over. So now it's not got the ability to fight the cold. So you end up actually the cold, is in full bloom and you take longer to recover because your immune system's worn out from going to the gym. So it's finding that balance. If you're someone who exercises regularly, okay, you should probably continue exercising, but tail it down a little. If you feel like it's achy, heavy cold coming, don't go to the gym because that's a real sign that your immune system's working a lot harder, and the last thing you need is to make it work harder by going to the gym.
Yeah. I think that's a tough one when your hormones are all over the place and you feel like if I don't go to the gym, that weighing scale is going to go up again. And, I can't tell you how surprised I've been over the last few years of my weighing scale keep going up. And then nothing in my diet has changed and nothing in my lifestyle has changed. So weight gain, is this common when you're in perimenopause?
Absolutely. It really comes down to our hormones again, because in perimenopause, our hormones are very, very chaotic. That in itself puts a lot more stress and strain on our system, which means it increases, our cortisol level. And that would also disrupt our metabolism.
And cortisol is our stress.
Our stress hormone.
Yeah.
So in perimenopause, our hormones that are fluctuating really also affects our insulin resistance.
Yes.
Yeah. And that's also why our insulin resistance and our what we call, our metabolism, our cardio metabolic risk. So you'll find your weight going up as well. There are all these reasons that's really impacting us. Yeah.
Oh, it's like one thing after another, and then it seems to hit you on some random day. It's not even, for me, my clothes didn't fit suddenly. And it was just my upper body. It was just so weird, just one random morning. And then a bunch of blouses that I was taking out of my closet just didn't fit anymore. And then the weighing scale kept going up, it was like a 0.2 and then 0.2 kg, another 0.2. And, you just really don't understand what's going on with your body. And my mom never talked to me about menopause. I mean, why should she? Her mom didn't do it. She didn't talk about it with her friends. She didn't know what to do. So I think she was suffering a lot in silence. And sometimes I would go home and then I would find that she's sneaking all these snacks full of sugar underneath some cloth so that I wouldn't see it when I would come back home. And then I would find it and I would tell her off because I didn't know what was going on in her body. And I think a lot of us are just managing this silently, right? There's still so much shame around this?
I think not only is there a lot of shame, but because we were all, we couldn't work out what's going on. And actually, clinicians had found it quite hard to work out what's going on as well.
Why is that? So were you trained in perimenopause? Like, did they give you, did they teach you anything when you were in med school?
So I'm going to quote the Marie study that was done by Hospital KKH recently. And you'll be shocked. It quotes that 90% of clinicians who replied to the survey said they have very little knowledge or confidence around treating women in perimenopause and menopause. One of the reasons really is that WHI study we have to go back to that was released in 2002. That point, because it decimated the confidence in the use around hormones was not talked about. So we have a whole generation not only of women who were deprived of the possibility of using hormones, but clinicians who didn't use the hormones. And actually, I was one of them. I qualified in 2000, so this happened soon after I qualified. So for a big part of my doctor training after that, I was not exposed to hormones as much as I should have. What shifted in the last couple of years was really the global movement by women themselves who started looking at this again and saying, no, well, we can't really be living like that. There must be an answer to this. Right. And so it started to uncover the knowledge around hormones, women's health, and what happens to us, especially in our 40s, and why are all women saying, very similar sort of stories and narrative of what you've just said. What is going on? What's shifting? And so over the last 5 to 8 years, we've started to see a shift from women themselves and clinicians who started to educate themselves from information and data that we can find from studies and start piecing them together. And this has really started to shift in the last couple of years. Yeah. So that is why.
Yeah. So if I'm a woman in my late 30s and I'm just listening to this right now, or I could be in my 40s or even 50s and in menopause, and I have done nothing to study my own medical data. I'm not collecting any information right now. Where should I start?
Start off by seeing your doctor and getting what I'd call a baseline foundational blood test. We're very fortunate in Singapore that this is done very, very commonly. Health screens, executive health screens are done here. Start there. Then make sure you get that repeated every year and find a doctor who would be able to pull all that data together and read it as a trend, using the lens of how we would look at health, not just perimenopause and hormones, but just health in general. Because we know the shift for women starts to happen in the 40s. We can start to see a trend. And we really see it as an opportunity for women to really start engaging deeply with their own health. So start with the basics. It's not, you don't have to go for all the, huge tests and, work out what we need to do with all of this just yet. Just start with collecting simple data that we're actually doing already.
Yes. I know when I came to you, you didn't ask me to do all these bunch of tests. Like, we just started with something super simple. And I would say to any woman listening to this right now, if you can, start collecting your own data. If you're not using any wearables, so you're not comfortable using wearables like the Oura Ring or a Whoop device or anything out there that just measures all the basic stats for your health, then at least take notes about how you're feeling every day. And I think we are, in some ways, the best doctors for ourselves because our body is talking to us all the time, right?
Absolutely.
So start listening to that. Thank you so much for this conversation and opening up my medical records, the laptop there, and just going through this. I know it's going to be so helpful for all the women out there. So if you enjoyed this episode, please hit subscribe, share it with somebody, and you're going to want to listen to this next episode where I deep dive into longevity and what really matters. Because I want to live till 95 and I want to live well. See you in the next episode.